हेलो एवरीवन, टुडे इन दिस वीडियो वी विल टॉक अबाउट ईटी ट्यूब। व्हाट इज़ ईटी ट्यूब, इसके यूजेस क्या होते हैं, इसके पार्ट्स नेम क्या होते हैं, चलिए देखते हैं। So here you can see the ET tube and endotracheal tube. ET tube is a flexible plastic tube inserted through the mouth or nose into the trachea, maintain an open airway, provide the ventilation and deliver anesthetic gases or oxygen during the surgery and critical care. Now we'll talk about the parts of the ET tube. So here you can see this portion is called the bevel. A side hole near the bevel is called PI. You can see, and this is a curved inflatable balloon. And now here you can see this mark is called the vocal cord marker. So here you can see that this portion is called proximal and machine end. Uh, it is also called a connector to connect with machine. And you can see this portion is called pilot balloon. So basically, ET tube has a two end. This end is called the proximal end. It's connect with machine, and this end is called the distal end. ये patient के side में रहता है, inside the patient. मतलब patient end भी इसको कहते हैं। अगर हम machine end की बात करें, जो डायमीटर होता है 15 mm होता है। अगर आप यहाँ पर देख सकते हैं एक वाइट कलर का एक लाइन दिख रहा होगा जिसको हम कहते हैं रेडियोपिक लाइन। रेडियोपिक लाइन क्यों कहते हैं? अ लाइन विजिबल ऑन एक्सरे टू चेक द ट्यूब प्लेसमेंट इनसाइड द। ये बात करते हैं ईटी ट्यूब के हर एक पार्ट्स के काम को। तो सबसे टॉप में आपको अगर दिख रहा होगा जिसे पेशेंट एंड डिस्टल एंड भी कहते हैं, तो ये वाला जो पोर्शन होता है उसको बेवल कहते हैं। ये स्लेटेड टिप एंड द लोअर एंड ऑफ द ट्यूब दैट इज द फैसिलिटीज इंसर्शन एंड मिनिमाइज द ट्रॉमा। Just आपको a side hole near the bevel that ensure gas flow if the bevel is blocked by the tracheal wall. So that is called the Murphy eyes. Above the Murphy eye, here you can see the cuff located near the distal end. When inflated, it seals the trachea to prevent the aspiration and leakage of gas. So here you can see this mark is called the vocal cord marker. It indicates your AD tube inserted inside the patient is correctly to the vocal position. Now proceed to the next part. This part is called pilot balloon. It is a one-way valve. Basically, a small external balloon that is show the curve inflation status. This portion of AT tube is called connector and proximal end. If I talk about the diameter of this connector, it's 15 mm. Universal connector that attach the AT tube to anesthesia circuit, ventilation or ambo bag. Now we will discuss how many types of AT tubes. So basically it is the two types of AT tubes: high volume low pressure and low volume high pressure AT tube. So this AT tube is a high volume low pressure AT tube. Now we will talk about now we will talk about the complication of AT tube. So during insertion, trauma to teeth, lips, tongue or vocal cord, esophageal intubation, wrong placement, hypoxia, laryngospasm, bronchospasm, pressure necrosis of tracheal